the easy answer to that is I tell people that's not my area of expertise. But honestly, you see, most of these claims are exaggerated.
I'm so sorry, everyone.
Okay.
Hello, Prof. Are you still there?
Yeah, I've been answering the questions
Hello,
on
can
the
anybody
chat
hear me, please?
box.
Yeah, we can hear you clearly.
Hello.
Okay.
Yes, we can.
Yeah, we can hear you.
And Prof is answering the questions.
Okay, I'll still go on. So about the herbal thing, but what I always tell people is this: if there is a claim, you see, even for the regular meds that we use, Zoladex, bicalutamide, abiraterone, we always check. The PSA is only one of the ways we check. Sometimes you need to do an MRI. So whatever the patient decides to use, herbs, some spiritual method, the important thing is let the person subject himself to check and be sure we have evidence to back up the fact that the tumor is actually regressing. There's a position going around that if a man does not have sex on frequent basis, such men are prone to prostate cancer. Well, a very good one. Yes, there were studies that suggested that men who have more frequent ejaculations had a slightly lower risk of having prostate cancer than men that had fewer ejaculations. And everybody ran with that. The truth is there had also been other studies that showed that that was not really true. But bottom line is this: we just encourage men to be as sexually active as they can be once it's done in a healthy setting. But you cannot say because a man has sex, no matter how frequently he can have it, that he will then not have prostate cancer. Because like I said, no matter the lifestyle adjustment we make, that can be an overruling factor, which is the man's genetic predisposition. So we encourage men to be as sexually active as they can, but it is not a consistently proven fact that frequent sex prevents prostate cancer. But we will tell people frequent sex has no harm. So we encourage men to be as sexually active as they can. I have used landmark abiraterone for 8 months now, and now on chemotherapy cycle. Can diet affect cure of cancer? Now, by the time somebody needs chemo, we're looking at disease that usually is metastatic. The goal of care in that case is to suppress the disease, and we usually will make that clear. The aim in terms of achieving a cure, to be able to say the disease is gone and is gone for good, we're only able to achieve that when you pick the disease early, meaning when it's still confined to the prostate. That's when we can say it's gone and it's gone. Once it has gone out of the prostate, we no longer talk about the cure. So that, I guess, answers the question of can metastatic prostate cancer be cured? For now, the answer is no. All of the new medications that that have come up, from abiraterone, that's Zytiga, to enzalutamide, Extendil, Sipuleucel T, all those new things, what they do is to extend the lifespan of the patient. Some 5-8 years ago, once somebody was no longer responding to Zoladex or removal of the testes, there was no other treatment, and maybe more like some 10 years ago, then chemotherapy, docetaxel-based chemotherapy came on board. That was the only medication that worked. And once that stopped working, there was no other option. But after that, more molecules have become available: abiraterone, Extendil, that's enzalutamide, and Sipuleucel T. It's just that none of these one will also offer a cure. What they do is to prolong to prolong the patient's life, which is what we usually focus on. And that is not a hopeless venture, because the longer you're able to keep the patient for, the higher the chances, there is always a chance of something else being found that can work yet again. I don't know if there is any other question I have not answered. You can bring that to my attention. Yes.
Hello, doctor. Somebody just asked that can biopsy cause cancer to spread?
The answer is no. There is a lot of, people will cite one or two case reports where people have documented what they call needle track implantation of tumor. It's something that, was something that people dispute. So something occurred once or twice in hundreds of thousands of cases. So that is the answer. The straightforward answer is no. If when cancer spreads, it spreads because it was going to spread, not because of it's not because of the biopsy. Like I said, there have been a few occasional cases of what we call, case reports of needle track, that is the cancer spreading along the needle track. But to a large extent, the answer is no. Because, and the reason why it's important to address that is, people will always cherry pick one exceptional case and run with it. Because this point you've raised is one of the reasons why men oddly refuse prostate biopsy, and say that, oh, it will cause it to spread. No. On thousands and thousands of men across the globe have had prostate cancer diagnosed with biopsy, and they did not have spread from, some corner in Lokoja to, Mobile, Alabama to, Ukraine to all over the globe. Records and reports, So, but people will always pick out something on the internet, some odd thing, and say that. It's just to reassure people so that if we have people who need prostate biopsy, yes, there are complications that can occur from prostate biopsy, bleeding, infection, difficulty with void. These things are usually treatable. But to now say it was a biopsy that made it spread, that's a no. Needle track implantation has been reported, but that usually can be tackled.
Okay, thank you, doctor. Toyo just told me that she needs Farooq to speak, but there's an important question there that I want to raise before we move to Farooq. Someone asked, how regularly should one check his PSA?
On the average, we just say once a year. Sometimes it may be more frequent, it may be less frequent, but on the average, we just advise once a year.
Thank you. Quick one. Do other cancers increase one's predisposition to prostate cancer?
We are not sure. There are some genetic studies that are ongoing to ascertain that. But because part of what people also say some studies have shown as risk factor for cancer would be things like some of this metabolic syndrome, and the same metabolic syndrome that can predispose a man to prostate cancer can predispose him to other cancer. So once somebody has one cancer, he can always develop another one. It can happen, but we don't have enough data to be able to say that once this person has this cancer, his risk of developing prostate cancer is more than average. But yes, there are people who have prostate cancer and have had to be that and have been diagnosed with another cancer. But it's not straightforward.
Thank you, Prof.
Yes.
I'm back to Toy now. I think Toy is fine, so I'm going to mute myself. Thank you.
Thank you, Prof, for that wonderful presentation. And I'd like to thank everybody for staying tuned this far. We're going to rush it because usually when we have this program, I'll make sure that it doesn't exceed 105 minutes. At this rate, I'm fast eroding my time. I would like to bring on my special guest, Mr. Farooq Oreagba. He's a wonderful person. He's my friend. He's just an awesome person. I promised that I was going to bring someone at the last meeting, someone living with cancer. And Farooq Oreagba is living with cancer. But before I tell you what his cancer is and all that has to do with cancer with him, I would like to read a short profile of him. Mr. Farooq Oreagba is the Managing Director, Chief Executive Officer Designate of NG Clearing Limited. He's a distinguished financial services professional with a wealth of experience in deal origination, capital markets, and investment banking, spanning over 2 decades. Over the course of his career, Farooq has proven his expertise as a derivatives sales trader, specializing in cash equities and derivative products such as equity index, single stock, fixed income, and foreign exchange contracts across various global exchanges. His exceptional track record extends to executing business development and fundraising strategies at reputable worldwide financial institutions. His bio goes on and on, but I would just like to round it up by saying that Farooq's academic background in business and finance, combined with his Bachelor of Engineering in Civil Engineering, to set the stage for a career marked by analytical acumen and a practical approach to problem solving. He's a qualified SFA Futures and Options Representative, UK qualified, and qualified as an SFA Registered Representative, UK, and a qualified equities and derivatives trader on NYSE, Euronet Exchange. Okay, I'm sure for those of us who are in the financial sector, understand all this I'm saying. And it shows that even with all that is going with him, he's living his life and it's been the best of himself. Now to go to the part that has to do with today's program. Mr. Oreagba was diagnosed with multiple myeloma. I hope I got that in 2014, and had a transplant the same year. He continued to have chemotherapy from then till August 2022, and is currently in remission. To put things in proper perspective for us all, myeloma is a type of blood cancer that develops from plasma cells in the bone marrow. It's often called multiple myeloma because most people have multiple bone lesions at the time it is diagnosed. Plasma cells are a type of white blood cells found in the bone marrow. Now, Mr. Oreagba is here to share his experience with all of us. And in recent times, I don't know if some of us have noticed on social media that he went viral. He's one person that is full of life and always the life of the party, which was evident at the 2024 Ojo Day Oba activities, where he stood out and shone like a star that he is. He has been named Mr. Steeze of Nigeria. He supports cancer awareness and supports initiatives and activities that support anything cancer. He runs to keep fit and is healthy and uses this tool to raise funds for various support programs. I remember last year or 2 years ago on his birthday, he asked all of us, his friends, to run and share this so that he can raise funds for some projects which he did. Our prayer to him is that he beats this disease and he lives a long and healthy life. Farooq, you are welcome to Let's Talk Cancer. Before I yield the floor to you, just a minute, please. Before I yield the class, let me spotlight you for everyone. Before I yield the floor to you, that's Mr. Steeze. Before I yield the floor to you, I would like to ask one quick question. And my question is this: you were diagnosed in 2014. Where was this? And what was your reaction? What went through your head and what had kept you going? You are welcome, Farooq.
Hi, good evening. Good evening, everyone. I hope you can hear me okay.
Yes.
when you asked me to come on the program, I didn't really know what to expect, but Prof gave a wonderful presentation, and I'm a lot better off for having listened to that. So thank you for that. Where and when? Interesting. Prof said that about 20,000 people a year died from prostate cancer, and that most of them only realize when the disease is advanced, which is basically they don't do their medical checks. Ironically, I was okay. I was perfectly healthy, and I did a routine health check, and I did a routine scan. I was not ill. I was not feeling any symptoms. I was not, just a routine scan. And lo and behold, I was told that I had cancer. The exact words were, they did a scan and they said these images indicate a high possibility of malignant activity. Which I said, what does that mean? They said, you got cancer. Luckily for me, I was stage 1. And because I was stage 1, even as Prof said earlier on, being stage 1 significantly increases my chances of survival. So that's how I found out. I just did a routine scan in the UK, and then all hell broke loose. Now, when I found out, or when I was told that I had cancer, I would say from that moment onwards, I can split it into 2 parts. One will be my initial reaction, and then my acceptance phase. My initial reaction, that was the experience. Naturally, you question, why me? What have I done? Why does it have to be me? In my case, I was very resentment. I resented everybody. I hated everybody. I hated everybody. Even my kids, my wife. Why should I be the one? I've worked all my life, blah, blah, blah. It's a really, really tough time. I really couldn't understand why it was me. I sought a second opinion. I sought a third opinion. Each time in the hope that you're going to get some news which would change, the whole setting. But in my case, everybody said the same thing in 3 different countries. And at that point, I live a life without a father. And I think that's what gave me the determination to say, fine. Luckily, I had healthcare, medical aid. Just as Prof said, it makes a big difference. So I faced the doctors, and it was a case of what can be done. They told me, and I just said, whatever has to be done, has to be done. Also, and I'll say this, one thing I realized was that no matter how bad it is, there is always somebody who's in a worse situation than you. There were people I was having chemotherapy with, and some of them have had cancer from birth. I was 48 at the time. I'd had 48 good years, and here's somebody who's 10 years old and never known a day of his or her life without being hooked up to a chemotherapy machine. So you have to start realizing that, no matter in every, dark cloud, there is a silver lining there somewhere. I can say the minute I accepted that I was going to give it my best shot, it wasn't easy. I'm just glossing over it. It was not easy. I cried enough times. I was scared. I was sad. But the minute I decided or made that decision that I was going to do this, and I'm also pretty stubborn as well, things got better. you know, I went into the acceptance phase. What do I need to do? They said, you need a transplant. Because as Toyo said, I was diagnosed with multiple myeloma, basically cancer of the bone. My bones are very, very brittle. If they break, they don't set properly. Contact sports are no longer are a no-no for me right now. And I just said, doctors, and I'm just, like I said, glossing over it. I said, doctors, what do I have to do? I had to do a transplant. I did a bone marrow biopsy. It was one of the most painful things I've experienced in my life, where they're taking the piece of your bone to go and test it. And also the social effects, because, you know, Nigerians in particular, but human beings, we can be very fickle. A lot of friends disappeared, but I can say this, I also I gained a lot more friends, a lot of friends from places I didn't expect. It's a very hard battle to do on your own. And that's the one thing I always tell everybody. If you are, particularly if you're the extended family or related to somebody who's fighting cancer, you got to be there for them. It's a really, really heavy burden to carry on your own. I was blessed. I had a few friends and relatives who stood by me. I have a lot more who disappeared, but then, you know, you learn from that. And also because I was doing regular chemotherapy, I saw a lot of cancer patients who were not doing so well. And I realized that even though it was tough, there were people who were in a lot worse situation than myself. And I got on with it. I did a transplant. I went into remission. And then after going into remission, I continued to do chemotherapy for another 7 years. I used to take chemo tablets. But towards the latter end, I started doing chemo tablets for 21 days in a row, and then I'd take a week off and then do another 21 days. But physically, I was okay. Mentally is where the strength is needed. And then after 8 years of chemotherapy, the doctors decided I should stop chemotherapy because the chemo treatment was doing more damage to me than cancer. My immune system was completely compromised. I was always getting sick for these silliest things. But what that also tells me is that there is a possibility it will come back. But then if it does, I'll deal with it then. The one thing, a message I need to tell everybody, I try and tell everybody, you know, a lot of people say cancer can't be cured, cancer can't be cured. Supposedly what I have is incurable. It may not be curable, but it can be beaten. I don't care whether multiple myeloma is curable or not. The doctors say it's not, but I can beat it. You know, and every day that one is alive, it gives one a chance of winning this battle. I believe there's an ultimate God up there, and we all have the same fighting chance of staying on Earth. So, you know, there's a tendency to be despondent and sad for those that are diagnosed with cancer. It may not be curable, as people may say, but it's beatable. And as long as you believe in that, you know, you give yourself a fighting chance. That's the most important thing. And from my part, I think Toyosi brushed on it. What I do a lot now and what I encourage everybody to do is, you know, cancer awareness. Early detection can save lives. It certainly saved my life. And it's in the long run, we're all better off for it. So I think everybody should try and consider that, you know, regular checks. For those that can afford it, medical aid, God forbid you ever need it, but, you know, trust me, if I didn't have medical insurance when I was diagnosed, I probably would not be sitting down here at the moment. So, but my attitude to life has always been, I live my best life. I actually have a joke that I share with people sometimes. which is if I was to say that I'm 58, if I was to say that I could live another 20 years, I'd say that being diagnosed with cancer is the best thing that happened to me, because it made me take stock of my life. It made me take stock of my people around me. It made me realize what's important to me as an individual, as a son, as a father. It sort of taught me how to prioritize things. I try not to sweat the small stuff anymore. I got bigger battles to face. So for those of us that are here that are battling cancer like some of us, I think it's important to remain strong. Don't be despondent, and just don't overstretch yourself. Take each day one at a time, and we'll get there. And then for those who are close to people or know people that are battling cancer, they may not ask for it. They may not tell you. But it's a big burden to carry, not just financially, but emotionally. It's a very, very big burden to carry. And they may not say it, but just by being there and giving them the support that they need, but may not want to ask for, makes a big difference. And like I say, as far as I'm concerned, cancer may not be curable, or some forms may not be curable, but it can be beaten. And that's what everyone should think about. Thanks. And now everyone's gone away.
We're here. Thank you.
Sorry.
We're here, sir. You just put us in a meditative mode. Thank you.
Yeah.
I'm sorry. I just wanted to share my experience. It's not easy, but I certainly appreciate life a lot more than I used to, if that makes any sense.
Definitely. Thank you very much. Toy, are you there?
Vegetative state.
Can you hear me?
Yes, we can now.
Okay, good, fantastic. Okay, Farooq, thank you so very much, very, very much for sharing. My question to you, probably maybe because I know you, I'll ask a question.
Yeah.
Your can I use the word vivaciousness? Can I use that word? Is it born out of the cancer? I don't want to say scare now. Can I use the word scare?
Experience.
Yes, experience. I think that's a better word. Because
Okay.
before you answer that question, let me tell the house, if you go anywhere and Mr. Oreagba is there, there's no dull moment. He's bubbling. He's making you feel like he has the best life there is. Nothing bothers him. It doesn't have any ailments or illnesses and all of that. So that's why I'm throwing that question at you for, because I know on this program, we have some people living with cancer. So they need to take a cue or some things away from you.
Something away.
Yeah.
Okay, thank you for that. Good question. I'm sure some people on this program know me anyway from childhood. And I've always been a bit of a rascal. I grew up extremely short. I was 4'11" when I was at school till I got to I was 15, 16. So I was always the shortest guy. So I was always very troublesome. However, being diagnosed with cancer sort of made me step it up a notch. I was one of those people, I rode motorbikes, I did all kinds of stuff. And we never take stock of our lives. And how do I put it? This was one scare that really, I'll call it a scare. It jolted me back into reality. And like I said, I'm a better person now. So what it has done for me is made me appreciate life a lot more. I'm sure you can see all these things on my hands. I got all kinds of tattoos. Only God can judge me. I've got another one which says, I live each day as if it were my last, so don't judge me, carpe diem. I want to go out with a bang. you know, like we all do. But, you know, everybody assumes they're going to live till they're 70 years old, or 75 years old, you know, and then retire to the village and go and play with their chickens. It doesn't always work out like that. But you still got to live. And, you know, try not to hurt anybody, try to remain positive. And, you know, sometimes God up there gives you credit, you know, say, okay, this person is doing well, let me give him another extra. So in terms of my vivaciousness, as you asked, I think came more to the fore once I realized that I had come that close to losing something that is absolutely priceless, which is my life.
Thank you very much. Thank you very much for that. Okay. I have some questions here that I'll be asking. There will be for you, Mr. Oreagba, and then I have another for Professor Omisanjo. Okay, so I think, Prof, this will be yours to answer first. He says, does removing one's scrotum negate or reduce the chance of getting prostate cancer? Prostate cancer. So
is that for Prof?
That's over to you, Prof.
Okay. Okay. First, allow me to thank Mr. Oreagba for sharing his story with us, and you're an inspiration to all of us. Thank you very much, sir.
Thank you, sir.
So removing scrotum, I guess the person really means testes. The scrotum is actually the bag where the testes sit. So the scrotum is just skin, basically. So now it's the testes that have the two testes that have some relevance to prostate cancer. Like I said earlier, the testes produce testosterone. Testosterone has a role that it plays in the man normally. It's the main hormone for masculinity. I mean, erection, production of sperm, and all that. Part of what it does is to stimulate the production of the growth of the prostate. Now, if somebody then develops prostate cancer, unfortunately, the testosterone will feed the normal prostate cells and the malignant prostate cells, the cancerous prostate cells. And so the testosterone then becomes a problem to that patient. If the diagnosis is made early and one is able to do surgery to remove the prostate with its cancer, you cure the patient of that prostate cancer. You don't need to bother about the testosterone. But if the diagnosis is made at the time when the prostate cancer has spread, has metastasized from the prostate to other sites, you can no longer remove the whole of the cancer. Then even if you remove the prostate, the bulk of the tumor is already out of the prostate. So once somebody presents with advanced prostate cancer, the focus then shifts to reducing the amount of circulating testosterone in the body to what we call castrate levels, so that you deprive the prostate and the cancerous cells in it testosterone. And by so doing, the cancer cells will die off. So there are two approaches to reducing the testosterone. You can give injections that will reduce testicular production of testosterone, even though the testes are there, or you just go and do a minor surgery to remove the testes. So that is a treatment, but we do not advocate that people should have their testes removed as a way of preventing prostate cancer. Certainly not. The way what we advocate for prostate cancer is screening, so that it's picked early at a time where you can offer treatment that do not require you to bother about the testosterone. So I don't know if I've cleared that. Thank you.
Thank you very much, Prof. Okay. I have another question here. I think it was triggered by Mr. Oreagba, but I have a funny feeling that the Prof will be the one answering this. He says, Oga Farooq coming on reminds me of the myth that tattoos increase the chance of getting cancer. Is this a scientifically proven statement? Can you help us with that, Prof?
Sorry, I didn't get that.
Okay. Basically, the question is that there's a myth.
I didn't get the question. Sorry.
Okay, can you hear me now? Hello, Prof.
Yes, I can.
Okay. Yes, the question is
I can hear you.
that there's a myth that tattoos increase the chance of getting cancer. Has this been proven scientifically? Is there any truth or anything in this?
I'm sorry, I can't answer that. I know tattoos do not increase the risk of prostate cancer. So will tattoos increase the risk of skin cancer, for example? You'll have to ask a dermatologist. That's my area of expertise. But there has been no association between tattoos and urinary tract cancers, which is my own area of expertise.
Okay.
So they increase risk of skin cancer. A dermatologist or a plastic surgeon will be of help.
Okay.
Seriously,
Thank you very much.
Seriously, if I may say something.
Yes, please, Farooq. Please go ahead.
All I'd like to say is, despite the number of tattoos you see on my body, I do not have skin cancer.
I think the way that answers that.
I don't have skin cancer, so I can't offer an opinion on that as well. But I don't have skin cancer.
Thank you very much.
My one thing I just wanted to share with everybody is a belief that I always have, and I always believe it's a saying that always spurs me on, that God will never lead you to what he will not lead you through. And by saying that, all I'm saying to myself is, whatever problems I have as an individual, I have somewhere in me, I've got the tools required to overcome that. It takes a lot of inner self, inner discipline. But as an individual, they say it's only when you have problem you realize how strong you are. May you never see problem. It's almost like it's a prayer. Listen, we've got one shot at life. You've got to make the most of it. Whatever it is, you're equipped to do it. Cancer, people beat cancer all day long. And there are people who don't smoke who end up with lung cancer. I don't know. I look at it as a lottery, but it's the cross I have to bear as an individual. But I bear it with a smile because there's still people who are in a worse off situation than me. I still have a bed. I still eat. I can still afford to buy data so I can be on your program, on your show. So we give thanks. And once you do that, you just keep on smiling. People ask me why I smile all the time. Why not? Anyway, I'll let you go on with the question.
I agree with you, sir. Thank you very much. Okay, there's another question here. Prof, this might be for you. How much is diet? How much does diet correlate to cancer? At least, how much does your diet affect cancer, kind of? I guess that's what the question is. Or how much your diet can help cancer?
There's this thing that we all say that everybody's a product of what, they eat. So now it's not as straightforward as somebody eats one particular thing and then you understand has a particular cancer. Sometimes Mr. Farooq made reference to, people not smoking and having lung cancer. And that is because we all know, for example, that smoking is a cause of prostate cancer. There has been a causal relationship that smoking causes it. For most other cancers, you don't have that kind of direct causal relationship. Again, we know that people who have HIV can cause a kind of skin cancer we call Kaposi sarcoma. Sometimes you have that kind of direct link. It's not like that with diet, that there is a particular diet that will automatically cause a particular cancer. At least not things keep changing. But we do know that, again, there are dietary patterns that can predispose people to cancers generally. And that's why we talked about I mentioned earlier on things like high carbohydrate, high fatty diet, diet rich in animal protein. Those things generally are said to be, predisposing factors to cancers generally, but they also predispose people to diabetes, cardiovascular diseases, and all that. So that's one thing that, yes, diet rich in fats, carbohydrate, animal protein can, across board, increase somebody's risk of developing any kind of cancer. But again, like Mr. Oreagba said, that, not, there are things. The reason why people will not smoke and develop prostate and develop lung cancer, because they may just have a genetic predisposition to it. Now, even when people develop cancer, two people who develop same stage of cancer will not always have the same outcome. The healthier anybody is, the better his outcome for anything, be it cancer, be it malaria, typhoid, or anything. So eating right, eating a healthy habit, a healthy diet, which we usually will mean as one gets older, less fat, less carbohydrates, a trend towards a more vegetarian diet. Sanjay Gupta was just doing a series on CNN recently where they said even, a vegetarian diet seems to protect people from Alzheimer's, dementia. So, the healthier people are generally, based on their diet, the chances, the better their chances at fighting diseases generally. So that's the kind of relationship that there is. But it's difficult to say, oh, one particular diet is a cause of any of these cancers we're talking about. It's not that kind of direct relationship, but the healthier dietary pattern is always helpful across board to protect one against diseases, inclusive of cancer, and in getting a good outcome for treatment. Thank you.
Thank you, Prof. I have another question here, but you've answered something close to this, but I think let me put it out so the person who asked it will understand. It says, thanks, Doc, for the in-depth lecture. Do other cancers increase one's predisposition to prostate cancer?
Like I said, not directly. However, there are ongoing studies that show that. So there have been some genetic link between, I think, breast cancer and ovarian cancer, some genetic things and all that. For prostate cancer, we don't have it that clear. There are some suggestions that men who have the BRCA antigen are more predisposed to having prostate cancer than people who don't have it. But for now, it's not as strong as the link between, say, breast cancer and ovarian cancer, that kind of thing. But of course, if somebody has cancer, part of what can happen is, as what we call the immune surveillance of the body. So the body's immunity is structured in such a way that not only can it target foreign cells like malaria parasite and deal with it, the body's immune system can also hit cancer cells. So there are some cancers that occur because the immune surveillance of the body has failed in some ways. So somebody has had one cancer, yeah, if it was due to some level of immune surveillance, some people argue that, oh, the person can have another one. But sometimes it's not so much as, the cancer being the cause of another one. Sometimes it's the treatment, and all these things. So simply put, it's not straightforward. It's just, but once somebody has a condition, we always look out, for the few people who may have a genetic predisposition to developing a second cancer. But there is no particular cancer that has been linked to prostate cancer as like once somebody has that, he will automatically develop prostate cancer.
Thank you very much, Prof. On this note, I would like to crave everyone's indulgence that whatever other questions we have, that we can send them to us via email at Let's Talk Cancer, LETSCALKCANCER 21@gmail.com. And you can also leave those messages and questions for us on Instagram with the same name at Let's Talk Cancer 21. And we will get back to you. Please follow our Instagram page as well. Before we round up, I'd like to say a massive big thank you to both our speakers. To Prof, thank you very much. There's been so many messages here saying well done and well done and well done to you. Someone even said the message is inspiring, scary, and it went back to inspiring again, and then eventually still scary. But he said, ha, ha, ha. So I'm sure that person has taken something away. And to you, Farooq, I need to read this message. It says, sir, if you bang any more than Ojudioba, it will be kaboom. So I think I needed to share that with you. So everyone here says a big thank you to you both. And I personally say thanks for taking our time. Usually we let this program not exceed 105 minutes. We've done 120 and we are on 125 since we started. And I would like to thank every member, everyone that has stayed in this meeting. Thank you very much for your time. I hope you've had a takeaway or two from this. As you log out, you get an email. There's a survey that we put out there because our talking about prostate today was based on our last event where it was touted. A lot of people wanted us to talk about prostate. That is why we brought this. So there's a survey we would like you to fill out, and then we will work with that. So once again, I say a big thank you to Professor Omisanjo and Mr. Oreagba. And also before we close, I would like to say a big thank you to my nephew, Tadi Ajiboye, because he has consistently, year in, year out, supported this project of mine. And he has been the, should I say, my Zoom benefactor. He keeps paying for this Zoom account year in, year out. Tade, thank you so very much. I'd like to say massive thank you to Bumi. She's worked behind the scenes with me to put this together. She's been my anchor when I was, when NEPA and Nigeria struck, and she has kept this going. And my gratitude again goes to my daughter, Olufunmilade. This face that you have here was made up by my daughter so that I don't look too badly on screen. I guess that was one of the reasons why I pinned my picture, my video on the screen and kept it going for so long. Thank you to her. And to every one of you here, I say a massive, massive, big thank you to you for being here today and being awesome guests. I look forward to having you the next time we put this forward. I mean, another program forward. The next event will come up in February. We try to do it twice a year. February, I use it to celebrate my birthday. And then in August, to celebrate my friend's posthumous birthday, which is why we're here. So thank you very much. Do have a wonderful evening. And if you do want a recording, you can go to our YouTube channel, please. Let's Talk Cancer 21. And you will see this recording and other past presentations that we've had will be there. Thank you once again. Let's have a wonderful evening. Let's stay safe. Let's check ourselves. Once you are 50 and above, please, constant and regular tests become very, very important. God bless us. The Lord will keep us safe and keep us healthy, and we will live very, very, very long, fruitful, and rewarding lives. Do have a wonderful evening. Thank you.
Thank you, too. God bless.
Right.
Thank you, everyone.
Bye, everyone.
Have a good evening.